Please welcome back to the stage, Cokie Roberts.
So now we are going to do some reliving because it was such a dramatic moment when this bill passed. And we're going to talk to some of the people who were on the Hill making it happen, who are now off the Hill, but who have wonderful memories. So please welcome Liz Fowler, who's now the Vice President of Global Health Policy at Johnson & Johnson, Dean Rosen, who's a partner at Mehlman, Castagnetti, Rosen, and Thomas, Joel White, President of Horizon Government Affairs.
Criticize, yell at
Hi.
Hello.
Hello, how are you?
Good.
So tell us who you worked for at the time.
I worked for Senator Baucus for the Senate Finance Committee, Democrat on the Finance Committee.
I worked for Senator Bill Frist, who is the majority leader, Republican majority leader of the Senate.
And Chairman Bill Thomas with the House Ways and Means Committee.
Okay, so you did, so for those, I mean, I'm sure you all know, but the Finance Committee in the Senate, that Ways and Means Committee in the House were the committees of jurisdiction. And they have their own differences, to put it mildly, and they're not just partisan. As Tom Foley, who was Speaker of the House, once said when some bright-eyed and bushy-tailed freshman came in and said to him something about the enemy, and Foley said, "Who are you talking about?" And he said, "The Republicans." And Foley said, "They're not the enemy. The Senate is the enemy."
This is going to be a friendly panel.
That's why I'm sitting between you.
That's right. So, the bill starts in the House.
Started in the House. It actually took several years to get to 2002, 2003, where the bill was in good shape, good enough shape to pass into law. There was a Medicare commission, and there was a lot of bipartisan work that went in, both in front of the cameras and behind the scenes, to get it to a place where we could actually consider it on the floor.
And how did that, I mean, with Bill Thomas, who could, I mean, I love him, but he could be difficult.
I've never heard that before.
No, I know. But how, I mean, was he working that?
Worked it constantly, and really, again, you know, go back to the Medicare Commission. This was a bipartisan effort. Senator Breaux and Chairman Thomas co-chaired that effort, and drugs were a part of that, and then that kind of was addressed under the President Clinton had a bill that was considered, and the House actually voted on legislation before going into 2003, but there were dozens of hearings and many conversations between the House and the Senate, actually, with Senator Frist, many conversations with Senator Baucus, Senator Kennedy, and others to get into a place where we could get the bill.
And were you considering it in the Finance Committee while the Ways and Means Committee was working on it, or did you wait until House action?
No, we were working on it as well. I think we had our own bill. Senator Baucus and Senator Grassley, Senator Grassley was the chairman at the time, had a very good relationship. They met every week, and we had been working on our own legislation that was different from the House bill.
It was different.
There's always a problem.
Yes.
And Senator Frist, Majority Leader, also a doctor.
Yep.
And so he was really knowledgeable about this as he was proceeding.
Yeah, he was, and he was passionate about it from a medical standpoint, not just from a legislative or policy standpoint, because, you know, you saw from the creation of the Medicare program in 1965 to the year that the prescription drug benefit started to become a very big deal in the late 90s, as Joel alluded to, and then when the bill passed, the power of medicine was, you know, so much more, as everyone in this room knows. And I think he felt, as a doctor, that it was really critical that tool for patients be part of the program, just like a surgeon's scalpel.
Which is very different from 1965. I actually remember 1965, and at that point the AMA was violently against Medicare, and you know, it was the strongest lobby you've ever seen, whereas in this case it was really a reversal.
Yeah, that's right. I mean, I think The earlier panel talked about this, but not just the AMA, but the AARP, and I think there was a growing consensus, the pharmaceutical industry, hospitals, really everybody was for it. It was just a matter of how you did it, how you designed it, how you paid for it, and I think a lot of time that the three of us and a lot of others spent, which sometimes today doesn't always happen on healthcare legislation, was trying to work with stakeholders, many of whom are in this room, to make sure that their views were at least heard and considered.
Well, and we ought to give a shout out to a lot of people in this room. It's almost like a little mini reunion.
That's nice.
So thank you to everybody who is in the room who worked just as hard on getting that legislation passed and implemented.
Yeah, this really was a group effort. I mean, ultimately, more than 600 organizations endorsed the legislation because they knew that it was going to, kind of transform Medicare. As Dean indicated, we were a hospital and a doc-based system. Medicare wasn't covering these prescription drugs, and that was a major problem.
Well, particularly since more and more healthcare is drugs as opposed to
Absolutely.
surgery or whatever. But you all keep talking about everybody was for it, but it almost didn't pass. So
We blocked out the pain.
So, talk about the process in the House of trying to get from all of this nice consensus to actually passing a bill.
There was a lot of different riptides and currents going on. You got to remember in the House, Republicans first of all controlled the House, the Senate, and the White House, and so you start out from a Republican perspective that we need competition and choice and market-based incentives in the program, and then we have a budget and we got to stick within that budget, and it was $400 billion, so we kind of divided it up as best we could, and people talk about the donut hole and time to make the donuts and things like that. Well, that was a function of the fact that we only had
X number of dollars.
X amount of dollars and $400 billion. And
that was when we paid attention to budgets.
To budgets, yeah. And well, some people thought that was too much. Some people thought that was too little. But we did, when we pulled the bill together, it was a process. We had a ton of meetings with different factions within the House, the conservatives, the Tuesday group, we were meeting with the Democrats. There were, it was a bipartisan bill at the end of the day. And getting everyone to yes was hard. But I think when you do big things, when you do visionary things, when you change the course of a program like this, and you add something in that's going to be so important to patients, at the end of the day, people saw that train was kind of leaving the station and wanted to be a part of it.
But at the end of the day, it was still the end of the day.
Tough vote.
So tell us a little bit about that.
Yeah, it was a tough vote, and I think there was an entire caucus that came together around the importation issue. There were
the what issue?
The importation. Who wanted at that time seniors were kind of and other beneficiaries were going to Canada to try and access cheaper meds, and that issue is still around today, FYI. But the importation issue, that is. And so we said, no, there ought to be insurance coverage for seniors, right? Rather than getting on a bus and going 20 hours, right? Like, we ought to have a benefit. And, but there was still a caucus who wanted importation, and we had to satisfy that demand. And there were state issues related to dual eligibles, and there were whole states who were threatening to bring their delegations down. And again, it was a matter of listening, plugging in changes to the bill, and then ultimately we had to get to 218, and we did, twice.
And getting to, but before we get to the second time of getting to 218, were you plugging in changes while the vote was going on?
Let's just say, like any vote in the House or the Senate, there are conversations that happen, and I think that there were subsequent hearings and things that happened as a result of the vote.
And as you all were sitting in the Senate watching this go on in the House, did you have the sense of, oh my God, we'll never get here?
Well, there's always that sense when you work on legislation, especially something like as big as this. There's lots of ups and downs and peaks and valleys, and times when it seems obvious and it's going to happen, and then times when you think it's all going to fall apart. But we were watching their vote carefully, but we had our own challenges in the Senate, I think. As much as it was a bipartisan bill, it was very controversial among the Democrats. Not all of them thought we should be going in this direction. Not all of them appreciated the role that my boss had played in negotiating with the Republicans. I think as they looked across the Capitol and saw the House bill that included not just a drug benefit, but premium support, which was a reform of the Medicare program that I think many Democrats saw as privatizing the program. They were really worried about what would happen when if the Senate passed a bill and we went to conference, would we end up with something that was so far to the right that they wouldn't be able to support it? So it was pretty controversial. So we had our own problems in the Senate.
And there were political issues, right?
Right.
The Democrats didn't want to give the president a win.
Right, right. Well, I mean, this was multi-dimensional chess and so many different layers of it. But I think, you know, I know President Bush is going to speak later, but really critical was that he had campaigned on wanting to have a prescription drug benefit, and there were differences that, you know, a staff were concerned about in terms of premium support or competition or importation, but Majority Leader Frist said, you know, the president wants this, he campaigned on it, and he put down an important marker because there were a lot of conservatives, and I have scars to show it, who criticized the fact that we were going to spend $400 billion that was not offset. But at the time, most of the Democrats, particularly the liberals in the caucus, were calling for $1 trillion benefit. So it was critically important that the president campaigned on it, that he felt it was a promise he needed to follow through on, that the leadership in the House and the Senate felt like it was a promise he needed to follow through on. And then all of a sudden there was a number. And the process in the Senate, I would say,
how did you get to that number?
I mean, I think, Joel.
Got it. Made it up.
Right. No, that's not.
No.
We actually looked at where most seniors were, right? And we knew all seniors had some drug costs, or most all seniors had drug costs. And then a narrower slice had very high spending, catastrophic spending. And then there was some people in the middle. So we really said, how much money would it take to cover people at the front end and the back end, and then the low income folks. And that's really how we divided up that $400 billion and came up with that number. But President Bush, to Dean's point, you know, you talk about the vote, he weighed in personally and in critical ways by calling members and telling him how important it was to get this done for patients and for seniors, as did Tom Scully, who was the CMS administrator at the time, as did Secretary Thompson, who was the
We'll hear from Tom later.
Yeah. One of the things that I think both have alluded to and is really, to me, important in terms of the process, it was particularly true in the Senate, I think, as Liz and I were talking about today, but also across the way, is that there was a level of personal involvement and a level of sort of trust. And I remember one really critical meeting you asked about the Senate process, where Senator Frist, who was a member of the Finance Committee, but also the Majority Leader, asked Senator Baucus, the ranking Democrat, and Senator Grassley at the time, who was the Republican chairman, to come to his office. And he said, I know the House, you know, is moving forward on a bill that's a little bit different. I'm a member of the committee. The one power I have as Majority Leader is to set the schedule. Right. So I want to have the bill on the floor by the week of before July 4th. I will work on it as a member of the committee, but whatever you two, meaning Senator Grassley and Senator Baucus and the committee, produce is what I'm going to put on the floor. And I think that was a really important signal in the Senate. It started to build some trust, and I think that carried through in terms of some of the tough negotiations, and Senator Baucus and Senator Breaux and others taking a big risk with their caucus and signing on.
Well, that's what I was about to get to with you, Liz, because we've talked over the years, really, and certainly at the time, about the problems the Republicans had with the conservatives, so with the new entitlement program and all of that. But you were having similar problems with the liberals.
Absolutely. I think there were a lot of concerns, not just about what the House bill represented and the fears that we would go in a different direction in conferencing with the House, but also just the fundamentals underlying the legislation. There was a reliance on competition and private insurance plans bearing risk for a drug benefit for a population that was guaranteed to use drugs. And I think
it's like flood insurance at the beach, right?
Or what we called insuring for a haircut. Who's gonna come to the table and actually take risk for a benefit you know you're going to have to pay out for? And there was not a market for a private insurance plan for prescription drugs for this population, and whether the market would actually come. And I think there was a lot of skepticism about that. So
I think all three of us could tell you that we all probably got yelled at by a number of folks in the private sector who would say, this is not something we do. We don't provide this insurance. You're crazy to try and design a program like this. No one will come. Right? No one will show up and offer the benefit.
If you build it, they won't come.
If we build it, they won't come.
Right.
And that's why there's a number of provisions in the law to ensure that those plans actually do come and show up. And now we have hundreds of plans, dozens of options in every state.
Well, how did you make it happen?
Well, remember, there was also a fallback plan.
There was a
that
fallback.
if the private insurance didn't come, which is interesting, it's almost like a public option fallback. And the same issues come up in a lot of different legislation. It came up also in ACA, the Affordable Care Act. What do you do when, if you don't have enough private insurer at the table, what are you going to do to make sure there's a market? So
We try not to talk about the fallback on the Republican side.
Right.
But there was that fallback, though, just in case.
And it was a bit of a leap of faith. I mean, I think that there was a lot of stakeholder engagement, and there was a lot of trust. And even though there was skepticism that this didn't sort of exist in nature or in the commercial market, that if you listen to folks, so I know that Joel and Liz spent a lot more time than I did, but we all spent time, not only with the insurance company executives, but with the actuaries and with the drug companies and with the patient stakeholders and everyone to try to design something that not only would be compassionate, but would work.
But so when they come and say, we don't do this, this is what are you talking about, basically? How do you then get them to the place where they do it?
Well, you have actuaries in the room, and we actually did work with the plan actuaries. So as much as the executive might be saying, I don't think this can work, some of the actuaries were in the sort of behind the scenes saying, this is how you could design it if you really wanted to make it work. Put enough dollars on the table, the benefit design, the sort of the tools, the flexibility, but with some ability to drive patients one way or the other, enough flexibility there.
And I think there was it was far from inevitable, but when you have the President of the United States and the majority leader and the Speaker of the House and the committees working forward on a $400 billion bill, most people were saying yes if, as opposed to no way. And I think that was really critical too.
We had some no ways in the House, but
I mean the private sector.
To your question, when we listened to them, we said, well, what would you need? And so some of the things that you see in the law, like the very high reinsurance at 80%, like when people get into, they spend a lot of money, they get into a catastrophic phase.
Right.
When Republicans talk about catastrophic insurance or whatever, it's kind of like you spend some money up front and then you're off the hook, right? Like your house is on fire and they're going to replace your house. Well, catastrophic in Medicare is not truly catastrophic, right? There's still, beneficiaries still pay above this out-of-pocket threshold, and one way that we said we need to get the plans in is we're going to have taxpayers subsidize 80% of every dollar above that catastrophic threshold as a way to make sure that they knew that they weren't 100% on the hook. But it's also a shortcoming in the law now because the plans did show up and we have a robust market, but we still have the 80%. And so I think a bunch of people have looked at that and said, maybe we ought to make some adjustments there. Maybe we ought to look at the out-of-pocket spend, because the challenge 15 years ago was seniors couldn't afford their medicines. Well, what we're seeing today is a big challenge is some seniors can't afford their medicines, even with a Part D benefit. Right. Yeah, and that's something we need to address.
And no out-of-pocket cap, no absolute out-of-pocket cap. So you're always on the hook for 5%, even if you hit the catastrophic. And I think that's something that you don't see in any other program except Medicare. So after ACA, you don't see that in the private insurance market, but you do in Medicare, and it's something that I think we believe needs to be addressed.
When you're going through this process, and now you can make it sound rational, but when you're in the middle of it, it's crazy. How did you just day to day put it together and make it happen?
We were
a lot of nights without sleep and time spent in a small room together.
We were talking just before this, and we said 17 weeks, and I think we had one day off in 17 weeks. That included Saturdays and Sundays.
I remember when the bill, and there were a lot of crazy moments when I thought it wasn't going to come together, but I've told the story once before, but at the very, very end, my daughter, who was, I think, about 6, well, she's 20, so 6 at the time, slept for 2 nights in the majority leader's office on the couch because my wife had to go out of town to help her sister, and I was the sole provider, and all of us had experiences like that where you're trying to balance the experience, and it was a little bit crazy, as you said.
Was it a nice couch?
It was a really nice couch, yeah.
Helps.
Yeah. Senator Frist had very, very good taste. Actually, yeah.
Go ahead. Keep going.
No.
Oh, come on. We're
Let's
almost
get back
there.
to the substance.
So we heard about the length of time of the vote in the House. So what was it? It was about 3 hours?
About 3 hours.
You know, and of course the roll call votes are supposed to be 15 minutes.
The floor, not a ceiling.
So what was happening during those 3 hours?
Well, again, I think there was a lot of, in the House at least, there was, kind of splits or factions where people were very nervous.
And were they all off huddling together? Were they,
there was like roaming groups of people on the floor who were, let's go address and talk to these folks, or let's go address and talk to these folks, because there were only a couple of votes that were needed. And like I said, there was an importation faction of folks who were very concerned about that issue and wanted some assurance.
During the vote?
Yeah. So there are issues like that, and it was just getting to a point where people were comfortable to say yes, because again, this is a Republican House, right, with a Republican Speaker and a Republican majority,
and a
people
Republican
were
president,
and a $400 billion entitlement program, and so you had to explain what are those things in the bill that you can sell to your constituents, and there's a lot of good things in that bill, like health savings accounts were part of this legislation, and that was huge for conservatives. And people kind of forget that this was part of that bill, but we had to kind of get over a lot of those different factions to get some folks to yes. But it was a nervous night. Let's put it that way.
And people forget, because the House vote was so dramatic, that the Senate vote was also not without controversy. And when the bill came back from the conference committee, we did not go through budget reconciliation. So we needed a supermajority in the Senate, and there were a couple of points of order, procedural points of order, which lied against the bill, and so we needed to get to 60 votes, and ultimately there were a lot of people who ended up not voting for the final bill, conservatives who were opposed to the spending, and others who ended up voting for it and just getting to 60, and that was nerve-wracking.
So you get through, you get this dramatic House vote, and then it comes to the Senate vote. And for the initial bill in the Senate, was that tough?
That was easier. We had 70+ senators voting for it, and part of it was that Senator Kennedy, who really spoke for the caucus and was standing sort of side by side, I think, with Senator Baucus and others. But when the bill came back from the conference committee,
right, so let's
stretch. Sorry.
So let's go through those steps.
All right, sorry, jumping ahead.
So at that point, you were okay. You were okay in just sort of initial Senate passage.
We were okay. Yeah.
But now it goes to conference committee, and that's always fraught, and there are winners and losers in the conference committee, and so it comes out of conference, and the House is fine with it.
No, that's where we had the problems, right? Like that was, but the conference itself was actually very interesting, because for most of Title I, which is the kind of drug benefit of the law, we had the Democrats at the table, and we were negotiating, and Congressman Rangel and Dingell and others were sitting there and helping to make some of those decisions. Now, ultimately, they voted against the bill, but it did have bipartisan support. And the conference kind of whittled down to what I would call the coalition of the willing, or the group of Republicans and Democrats who were putting the time in to get it done. And it was more Democrats in the Senate than in the House. So the conference process itself was that 17-week.
That was the 17.
That was the 17-week, yeah. And the vote was the 3-hour vote.
Was the conference.
Yeah.
And then you had to deal with it in the Senate, getting to 60.
Well, the challenge was that the Senate had this relatively bipartisan bill, 70+ votes. The House had passed a much more conservative bill with premium support and some of the things that the Democrats didn't want, but it only passed it by a vote or two. And so when Joel and his boss came over to talk to us, they said, well, you just take our bill. Because look at how much trouble we said. And we said, well, we still have to get to 60 in the Senate. So that became the challenge, was to try to marry those two and stretch it in a way. And that's what you saw at the very end, was that we stretched it to the exact limit that it could have, and not 1 inch more or 1 inch less. Yeah.
But we ended up losing Senator Kennedy in the process. And I think coming back from conference was much more controversial for the Democrats and a lot harder. And I think we had 12 Democrats vote for the final legislation, but it was down to the wire, like you said. And we had 54 votes for the final bill. So it was sort of by the skin of our teeth getting through the 60 the procedural hurdles before we got to the final vote.
And there were dramatic moments then, because you come back from a conference report where you've spent these 17 weeks and you hope you get it right, and then you've got 50 votes. But when we walked out to the floor, I remember the leader looking at me and saying, do you think we have 60? And we just did not know.
So you went to the floor without having counted 60 votes?
We hoped. And at the end of the day, what happened was very dramatic, which is you had some Democrats who ended up voting for it, and you had some conservatives who were against it, including Senator Lott, for example, who had been displaced as leader by Senator Frist. Right. And it was not something that he wished to do necessarily, to vote against the final bill, but to vote for the president's bill to get it over the 60-vote hurdle. But he was one of the last votes to get it right to 60. And so there were moments like that on the floor where we were negotiating with senators of both parties to try to get that.
You had no leverage. You couldn't send Senator Frist to talk to Senator Lott.
That wouldn't have worked very well. No. we had other members talk to Senator Lott.
And Senator Kennedy abandoned it because?
The bill moved to the right after negotiating with the House, and he felt like it wasn't quite the bill that we had passed in the Senate. So.
And it moved to the left from the House bill.
Right, sure. That's what conference committees do.
So I think one of the things in the House and the Senate, at least what I saw in the House and maybe what you saw in the Senate, is that you get to this point in politics where you do a major change like this, and people realize their vote is kind of like firing with live ammunition. Their vote is kind of like firing with live ammunition, right? Are we actually going to do this? There's kind of a pause or a stutter step where people go, okay, yes, we'll do it.
That's interesting.
And that we saw that in the ACA, we saw that in Part D, we saw that in other big bills that come through the House and the Senate.
So they suddenly realized, wait, this is a great big thing we're about to do.
A course-changing thing.
And if I vote, and my vote counts because it's so close, and do I really want to do this?
Yeah, I think that's right.
Yeah. How did you get the 12 Democrats?
I think, first of all, it was helping seniors. So again, let's look out to the audience for a lot of the people here who would benefit, and their constituencies who would benefit, and patients who were waiting for this benefit. So it was, at least among patient groups, really important legislation that made a huge difference in people's lives. And I think that advocacy is what made a difference for a lot of the Democrats, hearing from actual patients, not the politics, but hearing from people back home that they were having trouble paying for their drugs, that it was between paying for drugs or paying for food. We heard a lot of trade-offs, so I think that voice was really important for a lot of the Senate Democrats.
And there were two, beyond that, I think, very raw political things that made it possible too, and you may or may not agree with this, but from my perspective, one was very much talked about and one was less talked about. The one that was less talked about was that not all the $400 billion at the end of the day went for drugs, but there was also some money in here that was very important for rural hospitals and rural providers. And when you look at the final Senate vote, there were some prairie Democrats who ended up supporting it because their hospitals were just saying, we need this bill. Right. And the second thing that was much more visible was both Liz and Joel talked about this premium support, this kind of privatization in the House bill, which could not have passed the Senate with any Democratic votes. And so we ended up coming up with a compromise, and the compromise was kind of a very, in and of itself, controversial demonstration program, but to get there, we had to get the endorsement of the AARP. And I think the politics of having the largest, most visible senior organization, in addition to everybody else, saying we're for this, we're going to put our kind of money behind it and stand behind it, made it difficult for Democrats to vote against it, but also helped get us over the finish line. So I'm oversimplifying, but those two things were also critical.
Didn't you say you had to get Baucus, Kennedy, or the AARP? One of those had to sign on, and you could have done maybe without us, you thought, except you couldn't do without AARP if we didn't get us, but you ended up getting, I guess, 2 out of 3.
Yeah.
Well, that's the prairie. With Marcus, yeah. But so when that compromise happens, though, then it's peas on a knife, right? So at that point, you start having the peas fall off on the right.
Yeah, again, I would think that from our perspective, the conference report moved to the left. And, I think there was, a lot of people don't realize just how good Chairman Thomas was at not just working the House, but he was over in the Senate every day. I don't even know. I mean, but spending that time to talk to senators to get them to yes, both Democrats and Republicans. On the House side, yeah, we saw some people who were concerned that we had HSSAs as part of the bill. A lot of people don't know what HSSAs are. It's okay. They were never signed into law.
Well, tell us.
Well, they dropped out. They were like they were like HSAs on steroids, right? Like a lot of people said, like, these are tax shelters for very rich people for health care. Well, they dropped out. And that was a problem for some of the conservatives in the caucus. Premium support moved from a program to more of a demonstration. There was a trigger on Medicare spending that we had to add back in to say, if you exceeded this threshold, then you would have some automatic process to bring Medicare finances back into line. That got us some conservatives back. I mean, so it was a dance, absolutely. And it was just the right dance. I think Dean put it aptly, and that is, one more inch this way or one more inch this way, we probably wouldn't have had a law.
And I remember not only Chairman Grassley and Chairman Thomas, my boss, we had PowerPoint presentation that we had to go through with our conservatives saying, here's all the really good conservative stuff in the bill. And it was, spending
Make
cap.
Sure the liberals didn't see it.
Yeah, make sure that, and Liz had a different presentation, I'm sure, for her caucus. Right. But it was a balance, and it was people looking at it and saying, there's enough in here for me. I know it's not premium support as a conservative, but it's the first time that we're going to require wealthier seniors to pay a share of their premiums. That was positive. We know it's not full-blown premium support, but it's a demonstration. And on the Democratic side, I'm sure it was even a more difficult balance.
Well, I think part of it for us was every year we looked at adding a drug benefit to Medicare, it got more and more expensive. If we didn't seize the moment, it would have been so astronomically expensive to do it the next year or the next opportunity. And so $400 billion, when do you ever have that on the table from a Republican House and Senate and a Republican president? Putting this money towards Medicare, if you don't take that opportunity, you might not have that again, and it's just going to become even more difficult.
And we had, and I don't know how many people remembered it at the time that the vote was happening, but that had happened before. I mean, in the Nixon administration, when basically the liberals killed a health care bill that would have, gone a long way toward looking like the Affordable Care Act.
Well, and one more lesson we all brought to the table was the 1988 Catastrophic Coverage Act, which was repealed in 1989, and we actually took a lot of lessons from every piece of major legislation builds on previous legislation, and so from catastrophic, you can't just give a catastrophic benefit and ask people to pay for it and they don't see any benefit. So going back to the donut hole, you have to give somebody something that they can tangibly experience and benefit from. But you also wanted to protect people from the sort of high out-of-pocket costs. So that was part of why we ended up with the donut hole, but it was, bringing a lot of lessons to the table from 1989, the repeal of the catastrophic bill.
And another lesson, which I think the next panel was really instrumental in too, was it was going to take a couple of years to get this up and running. And so, but there was an election looming, and the president had made a promise. And so before we stood up the drug benefit, stood up these discount cards so that seniors would start to see some benefit right away.
Yep.
And that was a lot of work, but that was another major lesson of past bills, is give people something before you ask them to
Right.
eat the broccoli.
I mean, catastrophic health I covered like a cheap suit, and the and and as you might remember, some seniors in Chicago ended
Yes.
up as hood ornaments on Danny
Yes.
West and Cassie's car, and but it's not what people wanted. That's not what they really wanted was long-term care.
Well, they
But we
didn't want
had
their
that
premiums to double every year, which is what catastrophic gave them, right? And this was different in that we had that ramp-up experience of the drug discount card, which also gave the plans some experience to know who's in the market. What's the demographic?
Right.
How do I price my product? What infrastructure do I need to have in place to actually administer the benefit? So it was, yeah, give the senior something at the front end, but also let's ramp this up. But then 06 hit when the benefit came online, and Paul Krugman had an article in May of that year, and he said, this is D for disaster, right? The rollout was not a smooth rollout.
Well, we just were hearing that
even
earlier,
with that experience.
earlier panel. I mean, the chaos, long lines, all of that. But how could it be a smooth rollout when you're creating something so major, brand new?
Yeah,
I mean, it would be a miracle.
that's right.
But here we are, 15 years later, and you all must be feeling pretty good about it.
Yes, it's lasted, it's popular, it's really important for a lot of seniors, but I think the last panel also talked about some of the areas where improvements might be needed, and we talked about that earlier. A cap, out-of-pocket cap for seniors, I think, is one thing that's on the table that both Senator Wyden, the current ranking member of the Finance Committee, and the President support. So I think something to look at and something to strive for in the future.
Yeah, I have a teenage son, and I feel like the program's 15 years old, and it's kind of acting its age. Like it's a good kid, it studies hard, it wants to be helpful, but you know, there's a couple beers missing from the fridge. Like,
I have six teenage grandchildren.
so you know.
Lovely children.
Well, what Liz talked about, we're seeing these, what we heard last panel, right? The out-of-pocket cap and the challenges with out-of-pocket costs and the abandonment rates for people who have insurance but they can't afford it at the pharmacy counter. Those are real challenges, right? Like, and so I feel like let's build on the success and tweak it a little bit and move forward till we have a better benefit, more competitive market.
I think to me, one of the lasting things is beyond the substance, which has generally worked pretty well. You know, it's sort of refreshing to talk about, you know, you really like your teenager and they're mostly good. There's a couple things you wish they'd improve, like study a little harder, but for the most part, it's fundamentally sound. And I think that's a lot of because of the discussion that we've had here and in the previous panels, and I know you'll have, which is listening to stakeholders, the ability to trust one another when you're legislating and take the time to do it. The ability that's pretty rare these days where you don't get exactly what you want, but you still get enough of what you want that you see a positive benefit. And I mean, how many things have we done in the last several decades as a government that have come in providing as good, if not a better benefit than folks realized at a much lower cost. I mean, the federal government's not very good at that kind of thing. So I think when you step back and you look at it on a whole and from the big picture, it is something I think to be proud of. And I also think for current and future legislators to reflect upon some of the lessons of how it actually got done.
Well, I was thinking about that a lot as you all were talking, because I can't see it happening on the Hill today. And can any of you?
I can't see it happening. This was a bipartisan effort, truly bipartisan effort, that the members put an incredible amount of time into, that other staff and stakeholder groups did a lot of work on. I can't imagine with the current political dynamic that something like this would pass. Even the fact that it wasn't offset, I think today would be hugely problematic.
Yep.
Even though they are willing to break the budget.
Even though, yeah.
Do you see it?
I don't see that sort of agreement, but I do want to go back to the fact that a lot of Democrats really did have a problem with Part D when it passed, and I mean, you know, my boss voted for it, but that sort of belies a lot of the controversy that we saw within our caucus, bringing that bill back from conference, and it was an eruption of, you know, real raw, hard feelings. Not all the Democrats were in that space. So,
I think in healthcare now, you know, what you've seen the last few years is there actually is a lot of bipartisanship that doesn't get written about, but it tends to be on things that are a little bit smaller. On things that are bigger, and you can even look at, you know, Obamacare and the Affordable Care Act and the aftermath of it, which only got done because there were 60+ votes to begin with in the Senate. It was done only with Democratic votes, and that may be an object lesson a little bit in to do big things, it feels like these days, because the parties are more tribal and moving farther and farther apart on the substance of healthcare. For me, that it almost is hard to imagine anything big getting done without just one party, Republican or Democrat. Something like this, where parties come together, is harder to imagine for me these days.
we did try really hard to
Oh,
get
I know you did.
Republicans
I know you
on
did.
the ACA.
I didn't mean to relitigate that. But the fact is, it was all Democrats, and I think to the point is, just a few years later, you know, it's hard to imagine something big like that or something big like this getting done where both sides, even though it was mostly Republicans in this case, coming together.
Are you all still involved in your lines of work now with Part D?
Yeah, very much so, yeah.
Yes, very much so.
There are still improvements that can be made. I mean, the joke about teenagers notwithstanding, I mean, this really is an important program. I mean, when I think about the tens of millions of people who are benefiting, I mean, all of us believe that's important, but none of us are resting on our laurels. I mean, there is more work to do.
And I work for a major manufacturer, Johnson & Johnson, that sees the benefit of this. We have a lot of patients in a lot of these spaces, some of them represented in the previous panel, and this is a really important benefit, but we also see some of the difficulties that patients are having paying for their drugs and the inability, you know, we can't provide assistance to people who have trouble paying for their drugs, and it's unlike other programs where that's allowed, and it's really, it's hard to watch that for patients that can't afford their drugs now.
Yeah.
So the message to this group going forward is stay vigilant and keep plugging the holes?
Absolutely. There's always room to move forward and make improvements.
Yeah. The encouragement I would say is, like, MapRx is so good at this, but coming together as a community and identifying those issues is important. I think getting as many folks together in support as possible does still have an impact on the Hill and with the administration, and they're willing to listen. So MapRx plays a very important role in this process.
Yeah, absolutely. Being able to bring stakeholders together and marry the passion with the reports and the substance and other things that come out of it. And I think, as I said earlier, the fact that folks still want to improve this and work on it as opposed to, you know, tossing it out and starting again is really important. And
no repeal and replace.
No repeal and replace. not of this.
No, it really is. I mean, for all of the problems that both panels have outlined, it really is a great success story.
Absolutely.
No,
absolutely.
And, you all should be very proud of the work you did, the 17 days that you didn't get off, the baby on the couch, all of it.
Weeks. Those were weeks.
17 weeks, excuse me. 17 weeks, yes. I don't mean to denigrate it for a second. But really, congratulations for the work you've done. Thank you so very, very much.
Thanks.
Well, thank you.
Thank you.